This
more about this
conference will
because
now be recorded.
part of her clinicals were in the burn unit at Grady in Atlanta. But there's actually, once you get down past a certain layer of skin with these burns, what happens? You just don't feel it anymore, right? Because once you burn off the nerve endings and stuff like that, that's how you know you really fricked up. So if you burn the piss out of yourself and you don't feel it, that's not a good day, right? Because you're about to go through some really, really gnarly stuff. There's patients in Atlanta that they have to do those debriefings on and stuff like that. It's gnarly to look at. You don't want to be there, but yeah. So it depends on where the layers are in the skin, and there's a couple of different ones. There's like the rule of nines, the rule of palm, and a couple of different ways you can size burns. So we'll go over that later.
And they used to be classified as like first, second, and third degree burns. They decided to confuse everybody and change it. Now it's like superficial, partial thickness, full thickness. They all mean the same thing. They just change the names to confuse everybody. They like to do that every once in a while. They're like, oh, here, let's mix it up for y'all. So yeah, you have, so the functions, where was I? Sorry, I was here. Okay, yeah, so the functions, temperature regulation, water balance, protection, obviously, because if we had all our organs on the outside of our body, that would probably cause some problems, right? Excretion, and then shock absorption. So the bottom layer is the subcutaneous. That's where like our fatty layer is. That's also important to know, like if you're dealing with certain kinds of cuts, like if you can see the fatty layer, if someone's like cut open, that's a problem, right? It's pretty deep into the skin. So it is important to know the 3 different layers. Then you have your endocrine system. So we have our hormones are all produced here. So we have like our adrenal glands, right? Where do you think, we were just talking about parts of our nervous system. Which function of the nervous system do you think is like regulated by the adrenal glands? Sympathetic, yeah. And then we have our pancreas. Women have ovaries, men have testes. That's not politically correct, but I'm going to say it. Pineal gland, the hypothalamus, the pituitary gland, and then your thyroid and your parathyroid. Here's a bigger picture. So, adrenal glands, pineal gland, pituitary gland looks like a nutsack to me, but it's in your brain.
What you think, Brain Man?
Any input?
You think the pituitary gland looks like a nutsack?
I think it looks like a pituitary.
All right. So then we have our renal system. What's the main organ of our renal system? Right here, our little kidneys. So what is this right here that runs down? Ureter. Yep. And then this is what? Yeah, bladder, urethra. So our ureters, that's where usually kidney stones like to get stuck. So that's super fun if anybody in here has ever had a kidney stone. I've had patients that have had babies tell me that a kidney stone is worse than childbirth. So sorry if you've dealt with that. So our urinary system, it helps our body regulate fluid levels, filter out all the bad stuff, and adjust our pH. So if somebody's having problems with their kidneys, they can have a lot of like electrolyte issues. They can have fluid buildup. They can't get rid of that on their own. What medical procedure is done for somebody that has poor functioning kidneys? Dialysis. Yeah, so that dialysis is just taking their blood out, cleaning it like their kidneys would, and putting it back in.
So diabetes, they get sugar, don't That's where it gets weird.
Yeah, so diabetes can have cause a lot of problems with the renal system. So uncontrolled diabetes can actually cause like kidney failure. And then you can also have, why can't I think of it right now? Diabetes insipidus, which is just high levels of sugar, or like they're peeing a lot, but it doesn't so much have to do with like their blood sugar level. So.
You can really deep dive off into stuff because diabetes isn't just a sugar blood problem. You can have cerebral issues with sugar, where your brain's not getting enough sugar, and then we gotta go in and do a spinal tap to check your brain levels because maybe your body's getting enough sugar, but your brain's not. You can really deep dive off into some of this stuff.
Yeah, it's a horrible disease. Here's just another picture from your book. All right, so this says today's film is on the gingerbread reproductive system. If I hear any giggling, I'll turn the projector off. It shows a little cookie cutter. You guys can't see it very well. All right, so our reproductive system, obviously men's going to be a little bit different than women's. They have the testes, I can't say this word, the epididymis, the seminal vesicles, the vas deferens, prostate gland, the penis, and then whatever this word is, bulboreal gland. They're all in there.
You'll come to realize that 90% of people in EMS can't pronounce 90% of the words that we're supposed to be able to pronounce.
Yeah.
We just pronounce the important ones.
Yeah. And then we have the female reproductive system. So we have the breast, the uterus, the fallopian tube, the ovaries, the vagina, and the vulva. So some things to remember. Cellular metabolism requires a constant supply of oxygen and glucose. Absence of either causes a problem. The cardiopulmonary system combines the functions of respiratory and cardiovascular systems to provide oxygen at the cellular level. And then our favorite words in this class, shock occurs whenever the cardiopulmonary system fails and cells become hypoperfused. There it is. Air goes in and out, blood goes round and round. Any deviation of that is a problem. And that's it. Does anybody have questions on A?
Close your eyes.
I have a question.
No.
Yeah.
What does hypoperfuse mean?
That's a really good question, Mike. Thanks for asking. Does anybody have an answer?
Okay, it does mean shock, but the word itself, what does hypoperfuse mean? Hypo is low, perfuse is. Perfusion is the delivery of oxygen to the cells, right? So if you don't have enough of that, that's hypoperfusion, which is shock.
And we'll go into different types of shock because, you have like cardiogenic shock, neurogenic shock, septic shock, distributive shock. There's all kinds of different types of shock, right? So we'll go over all those as we kind of go along. Like I said, this chapter today, you will have a 50-question test over on Thursday. Yep. It's fun, right? And like I said, the first couple of chapters that we went over were
Austin, will you pull your cahoots up, please?
And you might want to bang your head against the wall. At this point, we're starting to get into important information, and I need y'all to retain it. So the chapter or the test and stuff are going to get a little bit, harder. You're going to have to go home. You're going to have to study this stuff. You're going to have to look at it, go over, the sheets that we gave you. Go over, the questions in the back of the chapter, whatever y'all need to do, redo your test, whatever you need to do. Like I said, it's going to be 50 questions. I made her look over it. The biggest issue I have making these tests is like, and I told Smith this, me and him were sitting there talking about it the other day, is I look at these questions, I'm like, well, this is stupid. This is easy, right? And then Smith is like, is it easy? Because, we have a bunch of people in here that's learning, and I was like, yeah, I forget about that. For me, some of the questions are easy, and so I have to try to pick through. So I run the test through multiple sources just to make sure it's not too hard and also not too easy. And so we put, a decent amount of thought process into these tests while we're building them. So I went through 180 questions and y'all only got 50. So be happy because I could have made it so much worse. So, just go home and study.
I thought there was an A and B on there.
There was. We talked about it the other day.
Yeah.
I have a question.
Uh-huh.
So two, that theory that the oxygenated blood is the pulmonary artery.
So, do veins or arteries carry oxygenated blood? Arteries carry oxygenated blood. There is one exception to that rule. Does anybody know? Pulmonary artery.
Yeah, the pulmonary
Those
artery.
are, so your artery and vein going into and out of your lung is the only exception to that rule. Right? Those are backwards. So that's the best way to remember that. Is if you can remember one, just remember it. Going in and out of your lung, flip flops. Why? Because medicine is weird. Don't know. But that's the only exception to the rule.
Who remembers how to remember the blood flow of the heart?
Remembers how to
Doctors don't count.
The
toilet paper my ass.
yeah, but what is that? Okay, good. What does that actually stand for?
The valves.
Okay, do you know what the valves are?
Mitral and aortic. I always forget the last one, aortic.
Pulmonary.
And then you're all thinking about it, you're all T, OPT, and then.
Yeah. I got some of those up there.
All right.
No.
Who got cahoots?
Bust your cahoots out.
Break out the cahoots.
No, bro. You can't team up with Joe.
So, like I said before, with these cahoots lessons, this is probably not gonna. Ow, you dick. It's not probably not gonna apply for this one in particular. We want to get used to everybody doing these. Here in the near future, you may or may not get gifts. You may or may not get gift cards for winning these things.
Found the light switch.
So, whoever wins them, you might get some stuff. So,
Is this individuals?
yep.
Oh, individuals.
Everybody log in. Get your hoops ready.
Donald Trump. All right, who did Donald Trump?
Oh. You guys take your public picture and just sign it.
Well, I know who I'm pulling for because I don't want to get beat tonight.
I like the thing.
I'm rooting for Billy. I like Panda.
So this one is chapters 5 and 6.
We got 17, 18. Hashtag Austin freaking unicorn. That is awesome that unicorn wants to put out there. Uh-oh.
How many? Oh, you're.
Who's the miss?
Anyone has Elvis hair now?
Just you? Hooting around. Hooting around. Hey, Jeff. Yeah, I've never done the
Joe, you got it? I'll give you a full ass guy.
What do you mean you can't scan it?
You need help? Got that water.
Hmm?
I'll show you a trick. So you'll run this once and you'll have it. We'll show you. On my- Voice capture.
Oh, that's cool. I'm never gonna remember that.
That's bottom right corner.
So this coming Thursday after our test, we're gonna do principles of physiology. The next couple of weeks is going to be kind of cramming a lot of information in when it comes to pathophysiology, anatomy, all that stuff. So just be ready prepared mentally. It's going to get kind of rough.
All right, is everybody ready?
All right, okay.
We're gonna start handing out the medication information. In 2 weeks.
Yeah, so we'll give you about 2 weeks. Say, what's the date?
11.
So today, tell you what, is it?
Oh, really?
The 27th. The 27th, I want everybody in, and I can put a grade in, just like I did for Saturday. So this will be graded. All you have to do is find a piece of paper and write all this stuff out. And the only reason why I want you to do that is because I want to make sure that I know that you can look at it. Yeah. Write a whole copy of paper. Right? Don't do it on the computer. Right.
I recommend flashcards. You don't have to do everything word for word.
Yeah.
Just as long as you understand. Yeah, just as long as you understand like what you can put down. You don't have to write step by step how to.
Right. But dosing, I'm not as concerned with the chart. I'm mainly worried about what the drug is, what the route is, whether it be PO, subcutaneous, intramuscular, whatever that is, what the dose is, what the indications are, which means why you give it, right? What the contraindications are, what like adverse reactions you can have out of those drugs after administration of them. Because, you know, a perfect example, right? Nitro. As AETs, you'll be able to assist patients with giving some medications, and one of those is nitro. Does anybody know one of the biggest downfalls of nitro after administration? But ironically enough, if you have taken any sort of donor drugs, you're not supposed to take nitro, right? Because nitro can cause your blood pressure to go. So if you get on scene and the patient's blood pressure is 90 over 50, do you want to give them nitro? No. And if you give them nitro, what do you think is about to happen? You're about to have to call me, and I'm about to have to come try to do some stuff because they're going to die. Right? So that's my big concern is I want you to know why you're giving drugs and what can happen when you get these drugs, right? So.
Okay. I think everybody's on here.
27, write it down on top of the paper.
I accidentally.
All right, you ready?
Here we go. Do we need to turn the lights off?
I'll think so.
Which root word refers to liver?
Dun, dun, dun.
Hepato, what's the other one?
Nephro.
Okay. So hepato, hepatic, that's all it has to do with your liver.
What does nephro have to do with?
And we had one gastro, yeah, gastro is your stomach. All right, Amanda. Which prefix indicates difficult or painful? All right, dis. So what word? Give me an example of a word that has this in it that means difficult. Dyspnea, that's a big one.
Dyspnea, I mean.
What about dysphagia with an S? Calvin? Difficulty speaking. Yes.
Dysphagia.
With a G. Difficulty swallowing. I remember that because G, gag.
Freaking cheater.
She's a cheater. Which prefix means below normal or low?
Mine is, I feel like it's over there, the answer.
Oh, they don't show up.
Oh, yeah, so I'm like, look at the way.
All right. So hypo. So below normal, hypoglycemia, hypotension. That means low.
Perry was the other one.
Oh yeah,
Hypoperfusion.
Perry. What is Perry?
Around, surrounding.
Oh, we got two cheaters in the room.
Which suffix refers to vomiting?
If you don't know what this is, you'll find out real quick.
Yes. So it's going to be emesis. So what is plegia? Plegia. Plegia?
Bleed bone is, what's that? Damn, it's porch bone.
What?
Plegia?
Yeah.
Is it not I can't think of the word right now, but it's bleed bone. Porous bone? Yeah, porosity, like porous, like pulse.
Like weak bones is what he's saying.
Oh, I don't think so. I think it has to do with like limited movement.
And what is Rhea?
Yeah, so plegia is like limited movement.
Emesis bag.
Emesis bag.
When somebody starts throwing up, you'll give me the help for the emesis bag.
Oh, okay.
What plane bisects the ear, shoulder, and the hip?
What plane?
Ear, shoulder, hip.
Oh,
Remember all the little planes that used to.
I read
So remember, this is the one that cuts you in half here. You want a corona sitting in front of you. So front and back.
I wish it was bigger. Holding up the road.
Michael, there's.
Blue CP.
Which line extends from the armpit to the ankle?
I was thinking yellow.
All right, so mid-clavicular is going to be in the front, right? So that's like your chest here. Axillary is your armpit.
Yeah, I actually went to go yellow. I never go full red.
Did you say what is sagittal again?
Yeah.
It's this way.
That one goes look in here and click in here.
Remember the arrow?
Right there.
Oh, yeah, okay. Now I will forget.
What quadrant is the appendix located in? Right lower quadrant.
There you go.
Right here.
Calvin thought he was aiming for his appendix.
What did you say?
Calvin thought he was aiming for his appendix.
What position is lying face down? So remember, prone is on your nose.
I knew. I meant to press that one.
How many vertebrae are in your spine?
Oh, quick, dude. Everybody's getting there quick.
33.
Right answer is none.
No. He's ahead by a lot. Y'all got some catching up to do.
I'm coming, don't worry.
What bones make up your fingers and toes?
Now stop it, Mike. Stop it back there. What's your handle? Oh, damn.
It is your phalanges. Fingers and toes.
Damn, leaderboard. Who's AWOL?
What was the pin?
What bone is located in your lower leg?
Who hurts?
303, 307, 2. Good job, Tibia.
So, real quick, where's your ulna at? In your arm. Femur?
Lower leg.
Foot. Foot.
I would say tibia. I'm sure there's an element.
Tibia, yeah, I always say tibia.
Tibia.
That's good.
Me too. What is another name for the eye socket? These are orbits. Somebody said maxilla. So your maxilla is your upper jaw. Yep. And then you have your mandible. Your movable mandible. And then your frontal. What am I talking about here? Frontal. Sphenoid? Anybody else? I don't know where that is.
No, so it's not important.
Yeah, not important. We're gonna Google it.
Somewhere around here.
It's in your nose. All right.
Oh,
Where in your nose?
freaking smirk in the back.
You said nose. Nobody knows. All right. What bone forms the back of the skull? It is the occiput. Yeah. What's the zygomatic? Yeah.
Your temporal?
The parietal.
You do got that one truck.
Bro, this is like
Yeah.
smacking y'all.
The inferior tip of the sternum is called the
That's the thing you don't want to break here in CPR. I'm doing the first one.
I guess there's a couple of them that are good answer for that.
I really don't care about this either. I said, I really don't care about the
Scapula.
You don't want to break it.
Where's the scapula? In the back, right? It's the shoulder blade.
Clavicle? Where's your clavicle at?
what's another name for clavicle? Collarbone. Good. And your manubrium, where's that? Little
7
notch.
o'clock.
It's a little notch shaped like a manubrium. So inferior tip of the sternum. What is that telling you?
So y'all remember when I was saying the other day, whenever you're doing CPR, if you go too low, you break that little spot off? That's what it is.
So if they said the superior tip of the sternum, what would be the correct answer? Manubrium. Good job. A distinct landmark on either side of the ankle. Your shooter always hit.
I'll stand up.
Yeah. It's in your shooter.
Like third.
It is your malleolus. So you have two malleoluses. Which one do you remember? Anybody remember the two? Yes, medial and lateral. That thing your scooter always hit when you were a kid.
What? Because what's the calcaneus? Your heel.
What's the chromium? Remember? Oh, chrome, man.
That's all, man. Hey. Good idea.
You will come to understand, she has the same for everybody.
Which of the following is not involuntary muscle?
It's not involuntary.
Not involuntary.
Double negative. What does that make?
Skeletal is the correct answer.
So what is an involuntary muscle? So what's the big involuntary muscle we have?
Which is why transplants are possible.
Cardiac muscle.
Good. And cardiac has automaticity, which means what?
Generates its own.
Electrical impulse. Its own electrical impulse. That's just important to remember, just saying. The area directly behind the mouth is the oral pharynx. So oral. Mouth. You have an OPH or oral pharyngeal airway. It goes in the mouth. Okay, so you have your laryngopharynx. Where do you think that would be? Yeah, larynx. Larynx. I can never say that word either. And then your hypopharynx and your nasopharynx. So hypo below, and then your naso is in your nose. A structure that protects the trachea from food entering. Good. Epiglottis. And if it's inflamed, what's it called? Epiglottitis. And what's the most common sign for that? Drooling.
That's okay, you can do that.
18.
Small sacs in the lungs where gas is All right, good. So alveoli, your ravioli, that's those little gas exchange sacs at the bottom of your bronchioles. So you go bronchi, trachea, bronchi, bronchioles, alveoli. Okay. Your phrenic, that's a nerve that has to do with your diaphragm. And then atelectasis, that is the collapse of your alveoli.
Strong.
The vena cava returns blood to the higher rectum. All right, so it is your right atrium. So right atrium, remember the flow of blood. Right atrium, right ventricle, lungs, left atrium, left ventricle. The vena cava is a vein, so it's carrying what kind of blood? Deoxygenated. Good. What is the only artery that carries deoxygenated? Got one aorta. It is not the aorta. The coronary arteries. What does your coronary artery do? To the heart, yeah, the heart itself. And then your carotid, what is that? And it's your blood to the brain, and then you feel carotid pulse where?
Tough to beat.
What valve is between the left atrium and the left ventricle? Yeah. It is your mitral. So if you think of the anatomy of a heart and where blood flows, right? So left atrium and left ventricle is right before it leaves the rest of the heart to go to the body. So it's not going to be your aortic because that's the very last one that it enters out of. But if it's between those two ventricles, it's the last stop before it leaves. It's going to be your mitral.
That's the mitral. What was the saying?
So this one you kind of have to put a picture together with the saying.
Wow.
This is still ahead. We have 3 players with the answer streak of 17. That's cool. This artery is palpated on the posterior aspect of the medial malleolus. I know, I can't find it. Your posterior malleolus. So it's right here. I still can't find mine, but.
Where do you look for a femoral pulse at? Anybody know? Right up here. And so if you ever have to look for a femoral pulse on somebody, you're going to get real close and personal with their areas. Wear gloves.
What about your coronary pulse? Where do you find that? It's a trick question.
You can. You might have some charges brought against you.
You open up the chest.
You stick a needle in and you watch for it to start.
Yeah,
Yeah,
watch for that
we actually have a
pulsate.
full
When
fiction
it
there.
pulsates, you know you're good.
Yeah.
Oh,
Oh.
no.
This pulse can be palpated on the top of the foot. Good job. So dorsalis pedis, so remember the top of your foot, dorsal, right? Where's your popliteal? Oh, no, you are.
There's another word for this. Does anybody know what it is? If somebody tells you to find. So if anybody tells you to find a fetal pulse.
It's not a pediatric pulse, fetal pulse. Where's their popliteal?
Behind your knee.
That one's really hard to find because there's a lot of structures there. Amanda's got a streak going of 24.
She's the steady one.
Hasn't missed a single one yet. Another name for red blood cells. Erythrocytes. What is your leukocytes?
White
White blood cells. And platelets do what? They help you clot, yes. Yeah.
Forgets how.
It does. Which of the following would be considered a central pulse? All right, so your central, remember we were talking about where you feel in the cardiac arrest? The carotid, the femoral, those are your central pulses. If it's your radial out here, what is that called? What kind of pulse is that? I like you thinking, but distal does mean. It's peripheral. So that's the way.
Central.
Peripheral. What is another name for shock? Y'all better get this one right. Hypoperfusion. Good job. What is anemia? Right. So not enough red blood cells. Anemia.
This guy gets diddled
What is produced with anaerobic metabolism?
There's a handful of these questions.
Yeah, but this part- Good job. It is lactic acid. We'll go more into this with chapter 7. So the best way I remember, anaerobic means without oxygen. Aerobic has air, so with oxygen. But the byproduct without oxygen is lactic acid.
I still didn't do my action shot. I got it right.
Cameras up.
Freaking cheater.
The brain and the spinal cord are collectively known as what?
answers there.
Quickly.
This is like the color. Find the most correct.
All right, it is the central nervous system. Central.
Oh, yeah, they have.
What is your sympathetic nervous system? Yeah, it's part of your autonomic nervous system, fight or flight. What's your parasympathetic? Resting. So what does your heart rate do when your parasympathetic nervous system is activated? Your heart rate slows down. And what does it do? Your sympathetic goes up. Good.
Oh.
Which of these organs is responsible for filtering out old
I was
red blood cells?
I should probably help him to give.
No.
What does the pancreas do?
Right behind Andy.
Pancreas? Glucose, glucose.
Glucose and glucose.
Yeah, we lost part of your lymphatic system.
I was gonna say sugar, but.
Cut it out.
Can you live without a spleen? Can they do a splenectomy?
We know you can live without a gallbladder.
Yep.
I can prove that.
What quadrant is the gallbladder located?
I'll get this.
It is your right upper quadrant, so your liver and your gallbladder are damaged.
Oh, yeah, we have
I feel like some of our folks really be on that one.
Life experience. What quadrant is the spleen located? It's the left upper quadrant, over here. What's the right lower quadrant? Appendix. Right lower, appendix, left lower.
I literally pointed it to, I got it wrong. Right and left.
Remember, it is the patient's right and left, not yours.
No, I don't know. Stop.
These go.
More.
2 more questions. What is the name of the system for the skin? Tegumentary. What's the endocrine system have to do with? Hormones. Yep. What glands produce epinephrine? Yeah, it is your adrenal gland. Huh?
No, epinephrine is actually a neurotransmitter.
Yes. Which of the following structures is shorter in women, leading to increased probability of urinary tract infection? Stop. It is your urethra. It is not your fault.
I was really close to
The other popular answer was ureter. Where is your ureter? Yeah, from the kidneys to the bladder. All right,
All right.
panda bear.
Cricket, and
I don't know who JS is.
then we have a cheater in.
Sorry.
Hannah.
Hannah.
All right, so everybody knows how well or how much they struggle with these questions. So you know what you did to study, right? So this is over the test you took today, and then the test you're going to take Thursday. So if you're struggling with answering a handful of these questions, you should probably go home and look over your stuff for Thursday because you have a 50-question test, and it's not going to be not just gonna be a bunch of bull crap questions. It's gonna make your mind work. So if you don't know it, you'll learn it.
I will say that, there's quite a few questions on the test that were reiterated multiple times. So if you're struggling with that, maybe reevaluate what you're listening to in class.
Austin, do y'all got any questions?
We're good.
Awesome.
So, remember, 27th, write it down on top of your